Hey everybody, my name is Robert Benjamin. Welcome to Urgent Care Insight. So today I wanted to do a follow-up video to a video to the last video that we did regarding autopilot in urgent care medicine, and we addressed specifically autopilot when we're reviewing vital signs. So I wanted to put this in a little bit more real-world context with a patient that I had recently. It was an elderly lady that came in for UTI symptoms. She had pretty typical symptoms: burning, urgency, frequency. Her vitals on initial assessment, when I looked, were good. Urine dip was pretty consistent with simple cystitis, and overall she looked fairly well. So I had gone back to my computer and I was putting in some the antibiotics and some other orders, and took a look at her vitals again, just because personally I know that I can get into these autopilot modes, and just wanted to double check. And I noticed that her blood pressure was 96/62. And so I had remembered in the past that maybe I had seen her, and I thought maybe she had been hypertensive previously. So I went back and I looked, and the last like 4 or 5 visits, blood pressures have been in the 130s over 90s, or even 140s over 90s. And it kind of struck me as odd that today, in the presence of a UTI, that she was 94/62. And so I went back in and talked to her a little bit more, and asked her a few more questions, and she said that she had felt fairly fatigued and just very tired the last couple days. Rechecked the blood pressure a few minutes later, and it was a touch lower. It was like 90/60. And I just kind of got this bad feeling about this, even though, again, when you looked at the chart, everything looked normal. There was no red letters screaming at me, or red numbers rather. And so I decided to have her evaluated at the emergency department, and later that day got some documents from the ER. And when she had checked in, she was a touch more hypotensive, and they did end up diagnosing her with sepsis, and she was admitted and treated. Luckily, there was no bad outcomes. But I just felt like this was a very classic case of where autopilot may have turned into a very bad outcome. And I think that you could take the same situation and put a heart rate of 92 or 94 into this context, maybe with somebody that's on a beta blocker, right? They're like trying to be tachycardic, but they just can't quite get there enough to make those numbers in your chart turn red. And you could have a very similar situation like that. So I think the message here is to make sure that you're looking at your patient and their vitals within the context of what's going on, and not always assume that normal is okay, because their normal may be very different. And looking at those previous visits can be very helpful, and making sure that you're catching these, not tachycardic, but elevated heart rates, or not hypotensive, but soft blood pressures. And I know there's some situations where these are going to be appropriate for the patient in the right clinical context, but there's some instances where these are red flags when they're, by standard practice and measures, they're not red flags. And so being able to pick those up, and this goes back to getting off autopilot, being actively engaged in that review and your assessment of the patient, can be very important, and it can save a life. Guys, thanks for joining another video at Urgent Care Insight. I hope you guys are finding this stuff helpful. God bless. Have a good day.